Chapter 2, Overview, the Nutrition Care Process. Learning objectives. Describe at least 3 factors that impact nutritional status. Explain why it is important to know the factors that influence a nutrition problem. Define the nutrition care process, NCP, and its purpose. Describe the purpose of the screening and referral system and who might be responsible for completing the tasks. Describe the 4 steps involved in the nutrition care process and each of their components. List the different types of charting formats for documentation. A person's health is a continuum that can change from a person being healthy and resistant to disease to having a chronic illness to living with a chronic disease or condition that significantly alters one's capacity to function well and finally to have a terminal illness. Regardless of the state of health, nutrition is very important. Registered dietitian nutritionists are uniquely qualified to perform and provide nutrition care to a person in different states of health to improve their nutritional status. The focus of nutrition care is different for various states of health. In addition to understanding the goal of nutrition care as it relates to a person's health status, it is also important to evaluate and determine a person's nutritional status. Assessing a person's nutritional status involves not only comparing the amounts and types of nutrients that a person consumes to nutrient requirements at various stages throughout the continuum of growth, health, and illness, but also examining the wide variety of factors that influence both nutrient intake and nutrient requirements. Human biological factors such as age, sex, illness, and physical and functional abilities determine nutrient requirements. For example, a breastfeeding mother needs to consume more calories and proteins compared to a non-breastfeeding mother. Infants and children require a much higher kilocalorie level per kilogram than an adult in order to support appropriate growth and development. Lifestyle factors, including attitudes, knowledge, and behaviors, influence the type of choices that one makes about food and physical activity. For instance, understanding which foods contain saturated fats can influence what type and amount of meats and added fats a person consumes. Comparing nutrient intake to nutrient requirement alone, however, does not describe the broader picture of nutritional status. A positive nutritional status implies that a number of internal and external factors that support optimal nutritional health are also present. Food and nutrient factors are the nutrients that are available for the body to use. Obtaining accurate information about a person's dietary intake is essential to evaluating nutritional status and adequacy of their diet. Environmental factors such as social and cultural preferences and practices are external influences that impact both food consumption and lifestyle choices. For example, people frequently consume more food than usual at a social event where food is served. System factors such as the health system, educational system, and food supply system impact the delivery of food, nutrition, and health services. A family whose income is nearly or at poverty level or lives in an area with unlimited food resources will likely purchase fewer fresh foods. Let me say that again. A family whose income is near or at poverty level or lives in an area with limited food resources will likely purchase fewer fresh food. It is important to determine both a person's health status and nutritional status because these both guide the type of nutrition care provided. Providing nutrition care can influence and change the factors that contribute to an imbalance in nutritional status and thus restore nutritional health. Accurately determining the underlying cause of the problem will permit the selection of the most appropriate nutrition intervention. For example, if lack of financial resources is the main reason why a person is not consuming adequate calories, providing a list of expensive oral supplements will not be effective. It might also be necessary to coordinate nutrition care and refer the client for support services and food aid. It is important to know that factors that influence a person's problem in order to provide nutrition interventions that are most likely to alleviate the problem. The nutrition care process is defined as a systematic problem-solving method that dietetic practitioners use to critically think and make decisions to address nutrition-related problems and provide safe, effective, high-quality nutrition care. This nutrition care process consists of 4 distinct but interrelated and connected steps: nutrition assessment, nutrition diagnosis, nutrition intervention, and nutrition monitoring and evaluation. A nutrition care process standardized language committee continues to meet in order to evaluate and revisit the language as needed. Standardized language refers to a uniform terminology that is used to describe professional practice. Prior to the development of the nutrition care process, the lack of standardized nutrition language and common terminology made it very difficult for dietetic practitioners to communicate consistently with each other and other health professionals. Nutrition problems and interventions were often charted using broad, non-specific language. For example, poor nutritional status, at risk for malnutrition or nutritional imbalance, might be noted in the chart as a red flag for nutrition care. However, these could refer to a number of conditions such as a change in weight, poor intake, or difficulty with chewing and swallowing. There was no easy way to clarify or measure and report on outcomes of nutrition intervention in various patient populations in order to demonstrate the effectiveness of nutrition care. The standardized language consists of precise phrases or terms that are organized in groups or domains and assigned unique alphanumeric code numbers. By using the nutrition care process, dietetic practitioners can demonstrate that nutrition care improves outcomes because it is a systematic method used to make decisions to provide safe and effective care, provides a common language for documenting and communicating the impact of nutrition care, relies on an effective-based approach, uses specific critical thinking skills for each step. Use of the nutrition care process to improve quality of care. The nutrition care process is a standardized process, a consistent structure and framework used to provide nutrition care, not standardized or generic care. When professionals use a systematic process with standardized language, there is less variation of practice and a higher degree of predictability in terms of outcome. Quality performance can be assessed by measuring clients' outcomes, end results of intervention and treatment, or the degree to which providers adhere to an accepted care process. The nutrition care process also enhances the quality of care provided by dietetic practitioners through the use of specific critical thinking skills. Critical thinking integrates facts, informed opinions, active listening, and observations. It is creative and rational, and it requires the ability to conceptualize. Each step of the nutrition care process identifies unique and specific types of critical thinking that, when applied, improves the likelihood that the process is being implemented in an effective manner. The provision of nutrition does not occur in a vacuum. This model is a visual representation that reflects key concepts of each step of the nutrition care process and illustrates the greater context within which nutrition care is provided. The model identifies other systems that influence and impact the quality of care. Big picture of nutrition care, the model. Central to providing nutrition care is the relationship between the client and the dietetic practitioner or team of dietetic practitioners. The client's previous experiences and readiness for change, as well as the ability of the registered dietitian nutritionist to establish trust, demonstrate empathy, and communicate effectively with the client's influences this relationship. It is important for dietitians to establish trust and be able to communicate effectively with others. It is essential that the client be actively involved in the care whenever possible and if culturally acceptable. This means that the client is aware of the purpose of care and participates in the decision-making process of goal setting and intervention selection. The central core reinforces the importance of providing care that is individualized and patient/client centered. The outermost ring of the model identifies environmental factors, including practice setting, healthcare systems, social systems, and economics that can have an impact on the ability of the client to receive and benefit from the interventions of nutrition care. The inner adjoining ring recognizes the strengths that the dietetic practitioner brings to the nutrition care process. Nutrition care also requires a great deal of collaboration with other healthcare professionals and community services. A screening and referral system identifies those individuals or groups who would benefit from nutrition care provided by dietitians. Screening may be completed by nurses, clients themselves, or through physician referrals. Screening parameters need to be tailored to the population and to the nutrition care services provided. The other system supporting the nutrition care process is the outcome management system. An outcome management system is used to evaluate the effectiveness and efficiency of the entire nutrition care process: assessment, diagnosis, interventions, outcomes, costs, and other factors when nutrition care is provided to a number of patients. Healthcare organizations use complex information management systems to manage resources and track performances. When nutrition services have systems in place that can measure and evaluate data from many clients, this data can be then combined with data from other nutrition care providers and be a part of evidence-based research that demonstrates the benefit and effectiveness of nutrition care, even to contribute to additional research for population health. Critical thinking used in the nutrition care process. Observe for nonverbal and verbal cues to promote effective interviewing methods. Determine appropriate data to collect. Select assessment tools and procedures. Organize and categorize the data in a meaningful framework that relates to nutrition problems. Make patterns and relationships among the data and possible causes. Make inferences. If this occurs, then this will happen. State the problem clearly and independently. Suspend judgment. Be objective and factual. Set and prioritize goals. Define the nutrition prescription or basic plan. Make interdisciplinary connections. Initiate behavior or other interventions. Select appropriate indicators and measures. Use appropriate reference standards for comparison. Define where patients or clients is now in terms of expected outcome. Decide between discharge or continuing of nutrition care. The first step of the nutrition care process provides important information that helps determine a person's health and nutritional status. It is initiated by the referral and or screening of individuals or groups for nutritional risk factors. Nutrition assessment should ensure that appropriate and reliable data will be collected for use in determining the specific nutrition problem or problems. Nutrition assessment focuses on understanding the wide variety of factors that influence a person's nutritional status. Obtain and verify appropriate data. The specific type of data gathered in the assessment can vary depending on the number of factors, such as practice setting or individual/group present health status. Cluster and organize assessment data according to assessment domains and possible nutrition diagnoses. The nutrition assessment in standardized terms are grouped into 5 domains. 1, food/nutrition related history. 2, anthropometric measurements. 3, biochemical data, medical tests and or procedures. 4, nutrition focused physical findings. 5, client history. Evaluate the data using reliable standards. It is not only important that data be linked to specific types of problems, it is equally important that the information obtained in a nutrition assessment be compared to evidence-based standards or ideal goals, and then calculate estimated nutritional needs. Nutrition diagnosis, the second step of the nutrition care process, consists of the identification of a nutrition problem that dietetic practitioners are responsible for treating independently. A nutrition diagnosis is written in terms of a client problem for which nutrition-related activities provide the primary intervention. The goal of nutrition care is to improve the health and nutritional status of the client/patient by impacting the underlying cause of the nutritional problem. Nutrition diagnoses and care focuses on nutrition issues that may be consequences of or contribute to disease or diseases. Nutrition diagnoses also address behaviors that impact food choices. Nutrition diagnostic terms are grouped into 3 domains. Intake domain contains nutrition problems that are related to the intake of energy, nutrients, fluids, biochemical or bioactive substances through oral diet or nutrition support. Clinical domain contains nutrition problems that are related to medical or physical condition. And then behavior environmental domain includes problems that are related to knowledge and beliefs, physical activity, and food safety and access. Nutrition diagnoses are written in a PES format, that is problem, etiology, signs, and symptom format that lists the problem it causes and appropriate defining characteristics. The problem is also referred to a diagnostic label. The etiology or related factors are those that contribute to the cause of the particular problem. The signs and symptoms are the defining characteristics obtained from the subjective and objective nutrition assessment data. It is generally stated in the following way: the problem related to the etiology as evidenced by the signs and symptoms. An example, unattended weight loss related to inadequate energy intake as evidenced by 8-pound weight loss within 4 weeks. The problem is the what. The etiology is the why. The signs/symptoms are the how do I know or how severe is the problem. Since the intent of the nutrition diagnosis is to describe those problems for which nutrition intervention is the primary treatment, it is important to develop PES statement that accurately reflects that intended. The following questions and criteria were developed to ensure that nutrition diagnoses are well written and accurately represent the nutrition problems. Number one, can the dietetic practitioner impact, improve, or resolve the nutrition problem? Number two, when all things are equal and there is a choice between stating the PES statement using two nutrition diagnoses from different domains, consider the intake domain as more specific to the role of the registered dietitian nutritionist. Number three, is the etiology truly the root cause? Number four, is there an intervention that will address the root cause, thus increasing the likelihood that a positive change will result? Number five, if it is not clear that the problem will be resolved by addressing the etiology, can an intervention at least reduce or lessen the significance of the signs and symptoms? Number six, are the signs and symptoms that are used to describe the problem specific enough to be measured? Number seven, will measuring the signs and symptoms indicate if the problem is resolved or improved? Number eight, are the problems clearly and independently stated? Number nine, does the assessment data used to identify the nutrition diagnosis system and link to the diagnostic statement, etiology, and symptoms, signs and symptoms? The nutrition diagnosis links nutrition assessment to nutrition intervention. An accurate nutrition diagnosis is generated from a focused nutrition assessment and sets the stage for the next two steps. The signs and symptoms or defining characteristics represent subjective and objective data obtained from the nutrition assessment in step one. It is very important that the data used to define the signs and symptoms of the problem will quantify or qualify the specific problem. The signs and symptoms that become the basis for setting measurable goals as part of step three, the nutrition intervention. There are also called outcome measures that are used to monitor and evaluate progress towards goals as part of step four, nutrition monitoring and evaluation. Accurate nutrition diagnoses set the stage for quality nutrition intervention and nutrition monitoring and evaluation. The third step of the nutrition care process is nutrition intervention, which involves both planning and implementing. Nutrition interventions are actions purposefully designed to change a nutrition-related behavior, risk factor, environmental condition, or the community at large. Prioritize the nutrition diagnosis. A nutrition assessment will likely result in the identification and labeling of multiple nutrition diagnoses. Therefore, before any action can be taken, it is essential to prioritize the diagnoses. This allows the registered dietitian nutritionist to arrange the problems in the order of their importance and urgency for the client. Write the nutrition prescription. A nutrition prescription is the recommended dietary intake of nutrients, energy, or specific foods or selected products based on the use of appropriate standards, the nutrition diagnosis, and the current health conditions. Set goals. It is necessary to identify patient-focused ideal goals, expected outcomes. Ideal goals are science-based values intended to control or improve specific health conditions. Select the nutrition intervention. The final step of planning is selection of appropriate interventions. Intervention terminology is organized into 4 domains. 1, food and or nutrient delivery. 2, nutrition education. 3, nutrition counseling. And 4, coordination of nutrition care by a nutrition professional. Implement the nutrition intervention. Implementation is the action phase of the nutrition care process. It is during this phase that the registered dietitian nutritionist communicates the plan of action to the client and other professionals. The central core of the nutrition care model recognizes that the client needs to be involved in this decision-making and action step of nutrition care. The purpose of the monitoring and evaluation is to determine the degree to which progress is being made and the client's goals or desired outcomes of nutrition care are being achieved. Monitoring refers specifically to determining that the goals and outcomes anticipated by the client and dietitian are indeed being achieved. Measuring outcomes requires collecting data over time. This is a critical component of the nutrition care process. It is not enough to just measure outcomes. Outcomes need to also be evaluated to determine what, if any, changes occurred as a result of nutrition intervention. Documentation. Documentation is an ongoing process that supports all the steps of the nutrition care process. The standardized language that is now part of the nutrition care process improves both the written and oral communication among members of the healthcare team as well as communication with the patient. Most commonly used forms are the SOAP method or format and ADIME. We will review these in class.